let's talk about erectile dysfunction. So erectile dysfunction is essentially the inability to achieve or maintain an erection firm enough for sex, and it's extremely common. Basically, the older you get, the more likely you are to have some degree of erectile dysfunction, and most men will experience it at some point as they get older. It's just a question of when. So let's talk about the normal erection. Essentially, there are nerves that send the signal to the smooth muscles in the arteries, or the blood vessels that provide blood to the penis. And so those smooth muscles relax, causing those arteries to open up and more blood to flow into the tissue. So the spongy tissue gets filled with blood, and that basically pushes closed the veins so that no blood then leaves the penis during an erection. And that's how you maintain a firm erection with that increased blood flow. So this is just a diagram showing the erect penis with increased blood flow. And there's many reasons for erectile dysfunction. Usually it's some combination of a vascular issue, meaning the blood vessels themselves are damaged, or diabetes, medication that a patient is taking, or other causes, or a combination of various causes. And obviously, if a man has erectile dysfunction, it can have a major negative impact on their quality of life. So we'll just briefly talk about each of these conditions. So diabetes is extremely common in American men, and it does cause erectile dysfunction, especially if it's uncontrolled and there's a long history of diabetes. And men with diabetic erectile dysfunction are less likely to respond to the pills like the Viagra and Cialis. So the reason why diabetes can cause erectile dysfunction is that it affects the nerves that send the signal to the penis that it's time to get an erection, and it also causes some degree of vascular dysfunction by damaging the arteries that send the blood to the tissues. But the main thing that we think about is the nerves, and that's why the pills like Viagra, Cialis might not work, because those pills only work to open up the blood vessels in response to the signal from the nerves to open up. But if the nerves are damaged, then the pills are less likely to work, and that's why men with severe ED related to diabetes are less likely to have a response to the pills. This just summarizes that same idea. Other factors, diabetes is correlated with increased age. If you have many years of diabetes or very severe diabetes, that's going to make it worse. If you have diabetes and vascular disease, or diabetes and heart disease, or you're taking other medications like diuretics, that's going to make it worse as well. Okay, we'll briefly talk about heart disease. So obviously, it's basically simple plumbing. The heart is the pump, and the arteries are the pipes. And so the disease can either be caused because your pipes aren't delivering enough tissue, enough blood to the tissue, or the pump, the heart, is not pumping it well enough. And in some men, it's related to heart disease. But most of the time, it's not really cardiac insufficiency that's causing the erectile dysfunction. It's more so that there's a lot of correlation. They have a lot of the same risk factors, right? High blood pressure, diabetes, advanced age, smoking, all of these things cause heart disease and also cause erectile dysfunction. So men who have erectile dysfunction are more likely to have heart disease, and vice versa. And actually, if you're a man with no history of heart disease, but you have erectile dysfunction, you're at increased risk for developing heart disease in the future. So that should be sort of a red flag. Usually within a few years of having erectile dysfunction, your risk of heart disease goes up. And basically, it's the same concept. It's an issue of blood flow, of these small arteries that provide blood to the tissue becoming less functional, essentially, and more narrow. And this just shows a diagram on the left. The arteries that feed blood into the penis are significantly smaller than the ones that feed blood into the heart muscle or into the brain or into the legs. So even a little bit of narrowing can cause a significant decrease in flow. And 50% obstruction may start to cause erectile dysfunction. And it's very important to know that you can reduce your risk of erectile dysfunction by improving your heart health with diet, exercise, weight loss, tobacco cessation, and reduced stress. So all the same things that a cardiologist would tell you, your urologist should tell you the same thing. And there's evidence to show that that does improve the erectile function and obviously improves the cardiac function as well. So should always be step one. Then we'll talk briefly about low testosterone. Basically, the testicles produce testosterone in men, but in some men they don't produce enough. It's more common in men with obesity, diabetes, high blood pressure, high cholesterol, prostate disease, asthma, COPD. But some men don't have any risk factors, and for whatever reason, their testicles just are not producing enough testosterone. So it's very reasonable to get that checked if you feel like it could be contributing to your erectile dysfunction. It's just a simple blood test. It has to be done early in the morning before 9 a.m. typically. And if you do have a low testosterone on multiple blood tests, then you can undergo testosterone replacement, and that might improve your erectile dysfunction, although it's not guaranteed. And there's multiple ways to do testosterone replacement. You can do a topical gel that just gets applied to the skin, a patch, there's pills, there's injections, there's all sorts of ways that this can be managed. It's been shown that testosterone replacement is safe and effective if it's done in the right way, meaning it's being done by a physician or a physician assistant or somebody who is giving you an appropriate dose and monitoring you. You can't just go to some friend at the gym who gives you testosterone. That can be very dangerous. But if it's done in the right way, then it's very safe and effective. Okay, and we'll talk about prostate cancer treatment as a cause of erectile dysfunction. This is one of the most common causes that we see. Essentially, the prostate is in between the bladder and the urethra, and a lot of the nerves that send the signal to the penis that it's time to get an erection run alongside the prostate. So you can imagine as you remove the prostate, some of those nerves are damaged. And you'll hear a lot of the prostate removal experts talking about nerve-sparing prostatectomy, and certainly that does exist. But even if you have the best surgeon in the world, and they're just gently pushing those nerves off the prostate as they take the prostate out, there's likely still some damage to those nerves that occurs. And obviously, if the cancer is more aggressive and it seems to be bulging right next to the nerves, the surgeon is more likely to be aggressive and take some of those nerves with it. Obviously, cancer treatment comes first before erectile function. So this is a very common cause of erectile dysfunction in men. And after prostate cancer treatment, sexual dysfunction is extremely common. The same is true for men who don't have the surgery but they have their prostate radiated. They will often get erectile dysfunction for the same reasons. Now, in men who have the surgery, that typically tends to improve over the following year after their surgery. But if it doesn't, it's not likely going to improve much more after that. Whereas with radiation, it's actually the opposite. It tends to have no effect initially, but it tends to get worse with time. Okay, Peyronie's disease, you might have seen commercials for this, the bent carrot, where basically there's scar tissue that builds up on the inner penile tissue that normally expands during an erection, and that part with the scar tissue doesn't expand, so the penis curves in the direction of the scar tissue. Now, this can exist in the absence of erectile dysfunction. You can have a rock-solid erection and it's just curved, but there tends to be a correlation. Men who have this tend to also have some degree of erectile dysfunction, and it's important to treat the erectile dysfunction before treating the curvature, because there's no point in having a straight penis if it can't get hard. And there's multiple treatment options for this. Xiaflex is a brand that makes an enzyme, basically a collagenase, an enzyme that breaks up collagen that's part of the structural protein of the scar tissue. And after repeated injections of this enzyme into the scarred plaque, it helps improve the straightening. It doesn't really make it go away, but it can provide some improvement. There's plenty of different surgeries to try to pull the penis straight, and there's also penile implants can help, but you would only put that in if somebody also has severe erectile dysfunction at the same time. Now, if there's just a mild curvature and it's not bothering the patient or their partner, there's no need to address the Peyronie's disease. It's not actually dangerous, but obviously it can be bothersome if the curvature is significant, and it does tend to correlate with erectile dysfunction. So obviously every treatment option has its risks and benefits, and that's something that you need to talk with your urologist about before deciding which one is right for you. Before we talking about the treatments for erectile dysfunction, I'll just make a brief statement about alternative treatment measures. You'll hear about this shockwave treatment, stem cells, platelet-rich plasma. I'm not here to say that those are fake and that they don't work, but I will say that they are not officially part of the recommendations by any urological association. And the reason for that is because there's not enough evidence to show that they are effective. If you are going to consider undergoing one of these alternative treatments, I highly recommend doing it in the setting of a clinical trial where you're with somebody who's doing a study on this and they have funding and approval to do these in a right way, and they can study the outcomes. Unfortunately, most of the time, these are more like a backyard operation where somebody, often not even a urologist, is just putting ultrasound waves, shock waves, or injecting different things into people's penises. Cash-only business, and it might work, it might not work, it may be a placebo. Nobody really knows, but I would definitely caution anybody going forward with one of these that you should definitely do it in the setting of a clinical trial and not just some radio commercial that you heard somewhere. In terms of the official sort of sanctioned options by the American Urological Association and European Urological Association, this basically shows the options, with on the left being the least invasive, your pills, Viagra, Cialis, on the right being your most invasive, penile implant, and in the middle, these sort of in-between options. So we'll talk about each of these. The most common, obviously, are the pills. They're called PDE5 inhibitors, but you'll hear about Viagra and Cialis most commonly. The generic names are sildenafil and tadalafil. They have that afil suffix, all of them, and you can sort of use it to help you remember that they're meant to fill the penis with blood, and they basically work to open up those blood vessels and deliver more blood to the tissue. And in most men, that's all they need, just a little extra dilation of those blood vessels, and the process gets going. There's some side effects in some men that have to do with increased blood flow to their head, essentially, or their stomach. They get headache or facial flushing, upset stomach, sometimes muscle aches. Any side effect like that would go away within hours once the medication gets processed out of your system. So it's still safe to try. This basically says these are, if you're taking this medication, you want it to be prescribed by a physician who's looking at what other medications you're taking to make sure there's no interaction. I recommend against going and getting one from your friend. It's pretty easy to get your physician to prescribe these medications for you. Obviously, in some men, the pills don't work, or they have side effects, and they have to consider the other options. And the other thing that I'll mention aside from the side effects is the cost. Insurance companies hate paying for these. So they can end up being pretty expensive, but there's usually some workarounds, like GoodRx or these other sort of coupons that can get the cost down. Also, a lot of online pharmacies are effective. The one that we've had a lot of success with is the Mark Cuban Cost Plus pharmacy. They get the pills for less than $1 each, and that seems to work pretty well. The next step for men who don't use the pills is the injections, is basically delivering the medication directly to the penis, so you can give a much stronger medication and you have less systemic side effects. It's not going to cause a headache or flushing because it's going directly into the penis. It is very effective, and it sort of bypasses the nerves. So in men who have had a lot of nerve damage because of diabetes or prostatectomy, this still has a good chance of being effective. And the biggest issue is the component that every time you want to have sex, you have to put a needle into the side of your penis. Now, it's the smallest needle that they make, and most men who do it say that it's not painful at all, but for some men, they report that it is painful, or just psychologically, they just don't want to put needles in their penis, which is totally understandable. We'll skip this. The vacuum erection device is sort of an external vacuum. The penis goes inside of this vacuum chamber that then sucks the air out of it, and that negative pressure helps to pull blood into the penis. It's usually done in conjunction with a penile ring, just basically a rubber band that goes around the base of the penis to help keep the blood in there, and also usually done in conjunction with the pills like Viagra and Cialis. It's basically like a boost. The advantage of this is that it's very safe. There's no drugs involved, and as long as you're using a rubber ring or a silicone ring and not some sort of metal ring, it's very safe. The issue is that it's kind of clunky and awkward, and people generally don't like it. But it is an option, and it has evidence to show that it does help. And then urethral suppository, essentially a medication that's delivered into the urethra, the tube that the urine comes from, either a pill or a gel that's injected into there. I don't have any patients who use this. There are some, it is in the guidelines that it is an option, but generally people hate this. They find it painful or awkward or it doesn't work, but it is an option to consider, and this medication is available. So one thing to add to the list. And then lastly is the penile implant. This is sort of the gold standard, meaning that if everything else fails or a patient doesn't want to try any of the other options, this essentially will work in pretty much everybody. It's essentially a 3-component device. You have the cylinders that go into the penis that are empty 99% of the time, and you have a reservoir, basically a little balloon with saline in it that's tucked underneath the abdominal muscles that's full 99% of the time, and you have a little pump in the scrotum underneath, next to the testicles. All of this is underneath the skin. You can't tell that somebody has one of these. And then when the patient wants to have sex, they push the pump in the scrotum, and that moves the fluid from the reservoir into the cylinders, and the penis stays erect as long as they want it to. Then they push the other button, and the fluid goes back out. So this is very effective, but obviously it's a surgery. It has the risks with any surgery that need to be considered. So we usually think of this as sort of the last option. Men who have this generally are very happy. They like that it works whenever they want it to. It's on demand. Doesn't matter what mood they're in, what they've been eating or drinking. They have it with them everywhere they go. They don't have to bring any extra parts. And it lasts as long as they want it to. So if they've had issues with premature ejaculation, that's sort of not a factor here. The downside is, again, that it's a surgery. So the biggest thing that we worry about, although it's rare when it happens, it's terrible, is a device infection. Reported about 2% rate of device infection, and if this thing gets infected, it's bad news. You got to pretty much remove the whole thing, and then putting another one back in the future becomes a lot more complicated, as you could imagine. And then there are some men who just complain about the way that it looks and feels. I mean, the sensations should really be the same, but they complain that their penis is not as long as it used to be, or this or that minor complaint. And what I tell people is essentially you have to think of this as a prosthesis. It's not going to replicate what you had when you were 20 years old, but it's a prosthesis that gets you something that works consistently. So if the goal is to have something that works consistently, then this, assuming there's no complications, will get you that result. If you go into it thinking that you're going to, be now a porn star and your penis is going to be like what you remember when you were 20 years old, that's just simply not going to be the case. Oftentimes, the penis has already shrunk from the last time you had an erection, either because of your prostate surgery that you had or because of your weight gain. Some of your penis is buried now. So the goal cannot be to recreate what you used to have. It has to be to get something that gets the job done. There's multiple different types. We almost always use the one on the left, the 3-piece inflatable one that I talked about. The 2-piece device, almost nobody ever uses. We'll sort of skip that. The malleable device is the simplest one. There's no hydraulics. There's basically just these malleable or semi-rigid rods that go into the penis. And basically when you don't want to have sex, you bend the rods down. And when you do want to have sex, you bend them up. So this is much simpler system, lower risk of having issues with the pump or the hydraulics of the system. But people generally don't love it as much because when it's down, it's not all the way soft, and when it's up, it's not quite as hard. But it's still hard enough to have sex, and it's definitely can get the job done, and is definitely an option. This basically just talks more about the 3-piece device. The device is coated with an antibiotic to lower the risk of infection. When it's flaccid, the penis looks normal, and when it's erect, it looks normal. You wouldn't really be able to tell that somebody has this. And this has been around for a long time. It's nothing new. It's just that people don't really talk about it. This is a video showing how it works. Let's see if I can skip to the good part. Like we said, the patient pushes the pump in the scrotum, and the fluid goes from the reservoir to the cylinders. The cylinders get filled with the fluid, and that causes an erection until the patient has decided that they no longer want to have an erection. They push the other button, and the fluid goes the other way, and the penis goes back down to its regular size. Yeah, it's an outpatient procedure, meaning you don't have to spend the night in the hospital, but you do have to undergo general anesthesia. Typically, we just do one incision that's only a couple inches long. Can return to regular activity after a few days, and you have to wait 4 to 6 weeks after the surgery to begin using the device and having sex. It's typically covered by insurance. Obviously, we'll verify that before doing the procedure. There's plenty of patient testimonials you can read about. Again, it's been well studied. High satisfaction rates. Obviously, it's a surgery. There's risks associated with it. And in summary, erectile dysfunction, extremely common. There's a variety of treatment options. You just have to find the one that's right for you, but there's no reason to suffer from this. And that's just my information, my 2 offices, and cell phone number. So that's also my personal website. So just reach out if you have any questions. Thank you. Thanks for watching. Please like, comment, and subscribe.